We're going to talk a little bit at length about shoes, and I apologize, I probably am going to go a little bit overboard on shoes, but this is really one of my passions. My family accuses me of having a foot fetish, but really what I have is a shoe fetish because I see so many problems from shoes. And so I really do harp on shoes a lot. And one of the first things I would recommend is to know your foot, okay? The people who sell shoes don't. The Foot Society did a survey of people who sell shoes, I think it was in the Chicago area, and only 10% of them had had any instruction on how to fit shoes, okay? Now, they knew all sorts of things about style and price and availability, but they knew nothing about how to fit a shoe. Comfort is your number one issue. If the shoe isn't comfortable, it doesn't matter what brand, what price, what special features it has, it isn't your shoe. And a good example of this is the last time I was buying running shoes, I was at Academy, and there was a gentleman there with his grown son, and he was trying on a pair of shoes, and he said, you know, this pair is so much more comfortable. I think this is the right pair. And his son said, oh no, Dad. Oh no, those are Rock Sports, and you need, what do you say, New Balance, because New Balances are better. Well, if they weren't comfortable, they weren't better, okay? And I hate to interrupt people when they're at stores, so I didn't get involved, but I really kind of felt sorry for the guy who was being told, even though those shoes feel great, don't buy them. Really, the difference between different brands of shoes is not the quality of the shoe. It's not going to be how well it's built. It's not going to be anything material except for the contours of the shoe. Every manufacturer has slightly different ways they build the shoes. The models they use are slightly different. And so, for example, I cannot wear a Reebok. It hurts my feet every single one I ever tried on. Doesn't mean it's a bad shoe, it just means it doesn't work for my foot. And so because one of you works with one particular shoe and someone else likes a different shoe, doesn't mean that's a good brand or bad brand. It just means your foot fits it better, okay? So you got to know what type of foot you have, and you also need to know what brands your foot will work for. And try on several until you find the most comfortable one. A wide toe box is ideal. Unfortunately, designers think the narrower the shoe, the more pretty it is, and we buy into that. So wide toe box shoes are considered unattractive, but really the more room you give the toes, the happier they're going to be. Consider athletic shoes. I know a lot of people have a hang up about wearing running shoes or tennis shoes on a daily basis. That's kids stuff. They really are better for your feet. And replace your worn shoes. For example, running shoes, really after about a year, they stop being as cushiony. Even if you have them sitting on the shelf, they lose some of their cushioning ability just sitting there. And so when you notice your shoe is getting kind of thin on the sole, it's not as cushiony as it was, replace it, okay? Because these things are designed to wear out, okay? The old leather shoes were designed to be reused over and over and over again, but they had no cushioning to begin with, so there was nothing to wear out. Our modern shoes are very, very cushiony when we buy them, and you know, by the time you finish about 200 miles of walking, you've lost about 60% of the cushioning in a pair of running shoes. So don't think the shoes are going to last forever. Really, don't worry about the price of a shoe. I mean, yes, there's some really cheap ones. You know, if you're getting a shoe for $20, you're probably getting what you pay for. But in the mid-range of shoes, really there's not much difference. And some of these shoes that are $200 a pair, please, there's nothing different about them except who's marketing them. And so really don't worry about the price so much. There are three basic types of feet. Most people have a normal foot. Most people have what we call a neutral axis foot, and they can wear all your regular shoes. A small number of people have the other two types. One is called a supinator, one is called a pronator. Those are doctor terms. Pronator has become part of the common lingo in shoes. Supinator has not. And typically the supinator walks on the outside of their foot and the pronator walks on the inside of their foot. So if you have calluses on the inside of your foot, then you're probably a pronator. If you have calluses on the outside of the foot, then you're probably a supinator. Okay? That's really it in a nutshell. You can look at the back of the foot and how you walk. This is how I train my residents to look at people to see whether they need special shoes or not. And basically, this is what most people do. And this is a right foot, just to let you know. And then the underpronators kind of tilt to the outside with their heel pointing inward. And then the overpronators tilt to the inside with the heel pointing out. And pronators are very common compared to supinators. About 20% of the population are pronators. And they benefit from shoes that support them on the inside of the foot. Unfortunately, the only shoes you can buy that way are running shoes. And so for a lot of my patients, we use walking shoes with an insert to support the inside of the foot. You can do it by looking at the front. We call this the peekaboo heel sign. If you look at someone from the front when they're standing and you can see their heels kind of poking in, we call it peekaboo heel. On this one, you can see the heels are well hidden and they're kind of out to the side. This is not absolute, but most people who have a high arch are going to be your supinators, and people with a low arch are going to be pronators. You can look at your foot when you're at the pool, walking along on the dry concrete with wet feet. But most of us know what our arch size is anyway. When you go to buy shoes, that if you're a pronator, and I'm in that category, unfortunately, they use marketing terms, and they use tons of different terms, and it can be hard to pick it out. And, you know, if you go to Academy and ask the little salesperson, I'm a pronator, I need a shoe for that, she's going to run off in terror because she has no idea what you're talking about. And it actually has happened. I've actually asked a question, and the person has disappeared on me. And that's because, like I said, they're not trained. No one has told them about this stuff. And so for overpronation, they call these shoes motion control, stability shoes, medially posted shoes. And you can recognize some of them because they make the different plastics so obvious you can see them. And it's just a little bit of more rigid plastic on the inside, so it kind of forces your foot to roll inward. And it really does work. It actually can make a big difference in your gait and in your foot pain. For people who are the other way, they actually, what they need is a really cushy shoe. Not so much a shoe that pushes their foot the other way, but one that will just cushion them, because their foot is too rigid, and that's really the problem. And so they just need extra cushion. And so they'll talk about shock absorbing, cushioned, extra soft will be the words they use to describe these shoes. And they typically come with a really big arch in them because they think that everyone that has this has a huge arch. That's not always the case, but that's typically what they do. Sizing of the shoe is very important. On the handouts that were out there, one of the things is a guideline from the Foot Society about how to pick out shoes. I picked out my favorites out of that list. And basically, do it at the end of the day. If you size your shoes first thing in the morning, they're going to be too tight by the end of the day for most of us. You want to size the larger foot because most people, more than 50%, will have one foot that's half a size different than the other foot. I like to tell people to trace their foot on a piece of cardboard, and this is more for fashion shoes, but you put the shoe on the piece of cardboard, and if you can see a lot of the cardboard around the edges, that's not your shoe size, okay? There is no break-in period for shoes. They should be comfortable the first time you put them on, and you shouldn't have your heels sliding up and down all over the place. A little bit of slip is okay, but if you have a lot of motion at your heel, something's wrong, okay? And unfortunately, as we age, the front of our foot gets larger, but our heel doesn't. And so some people end up having to do things like this, which are inserts that go in the heel and kind of grab your heel. And what that can do is for people who have a narrow heel and a wide forefoot, they don't build shoes like that for you, unfortunately. And so these little inserts stick to the heel and just make the heel a little narrower, okay? And so that's one option you can use for that. If you really wealthy and want to go have custom-made shoes, you can have narrow heel, wide foot, but otherwise you're out of luck. Some things that can help your feet in general. Number one, obviously, the more weight you put on your feet, the more wear and tear on your feet. Not that we're going to lose weight just to make our feet happy, but it's something to keep in mind. Staying active is extremely important. One of the things that it's hard to talk to people about is balancing overactivity or things like the ballerina that hurts your foot and routine daily activities. Joints get their nutrition from the fluid that's in the joint. And if the joint doesn't move, the fluid doesn't circulate, and they don't get their nutrition. So cartilage really benefits from routine daily activity. And so one of the ways that you can actually help your feet is to stay active. And what my preference is walking. I think walking is a wonderful exercise, and the more you do, I think the happier your feet are going to be. Within limits, and some of us go for 20-mile hikes and our feet are miserable for days, but routine, regular walking is ideal. Dancing would be a good one, provided that you're not in some of those dancing shoes I see on the women out on the floor. I don't know how y'all dance in 4-inch heels. I just don't understand. Foot exercises. The recommendation made by several authorities is to exercise the muscles that keep your toes straight. And the easiest exercise to do for that is you throw a towel on the floor, you take your foot, you crinkle up the towel, then you throw the towel on the floor, you crinkle it up with your feet. That motion of grabbing stuff with your feet actually exercises those muscles that are located within the foot. And it's probably the only exercise that people could routinely do and not drive themselves crazy. There's some other ones out there that I've tried and I don't think I would recommend. But one thing that is critically important, and I see it over and over and over again in my clinic, is people who are too tight. They need to stretch. And the heel cord seems to be the worst offender. And the reason is really quite straightforward. When we walk, the leg that's behind us is straight. And the way we normally, with our gait, we lean forward before we pick our heel up. Well, if we can't pull our foot up with our legs straight, then what happens is we try to bend our foot. And the foot isn't designed to do that. And so we put increased pressure on the front of our foot, and we stretch something called the plantar fascia. And I get a lot of people in my clinic with something called plantar fasciitis. Anyone ever heard of that? Uh-huh. And the first thing I do is I check their heel cord. Would you guess how many of those people have tight heel cords? 80%. First thing I do with them is I put them on an exercise program to stretch out their heel cord. Really important. Stretch that heel cord. Keep it limber. The easiest stretch, of course, is the one from high school where you set your foot back in the back, you bend your knee, you put your hands on something so you don't fall on your face like I'm about to do, and you lean your hips forward. You keep this foot straight, you keep leg straight, you keep the heel on the ground. You should feel the stretch in your calf. And believe it or not, that is the best way to get rid of heel pain. And it's all because we don't keep ourselves all stretched out. Okay? I get a lot of questions about orthotics. In my practice, orthotics come in 2 flavors, over-the-counter and custom. Custom is only used for people who have foot deformity that need to be controlled. The over-flat foot, things like that. I rarely use custom orthotics. I use a lot of these over-the-counter orthotics. And sometimes, like you can see in the picture up at the top, I modify them with little pads. And the difference is a custom orthotic is about $200 a foot, and this is about $30 a foot. Okay, huge difference, and most of them I can get the same effect. The other thing is, these are soft. These are giving. Those hard plastic things, I don't know how anyone wears them, but I give them out to people all the time when I need their strength to control something. And I see a lot of people who come to me and I say, I need to get you an orthotic, and they're like, whoa, whoa, whoa. I bought these $400 orthotics at the mall, and they didn't help me at all. Don't recommend that. I would recommend custom orthotics only on the prescription of a doctor or podiatrist. And over-the-counter ones, you can figure it out. And if you can't, talk to someone, a doctor or someone who does shoe wear type activities. But I really don't think custom orthotics benefit people on a routine basis. Well, thank you all for your time.
This program is intended for the private use of health.edu subscribers. Any rebroadcast or redistribution without the express written permission of health.edu is prohibited.